Hi, Alex.
Oh yeah, you're right.
I'm very well. Thank you very much for joining me in this
Thank you for
podcast
having me.
today.
Yes.
For our viewers and listeners who
Mhm.
don't know you, please tell us a little bit about yourself, who you are, and what you do.
So my name's Alex. I'm a surgical nurse here at Solihull Hospital. Been here for about 4 months now.
Mhm.
Um, Started my career probably 4 years ago. Obviously, in nursing training. Was a baker before that, funnily enough, but
Okay.
sort of went to nursing. True calling, of course. But yes, I've been working for UHB since. Absolutely love it. I'm on a surgical ward and I've really got to fit in at the moment. So just taking each day as it comes in nursing, as you have to do, I suppose. And just going from there, really.
And how long have you been here? Sorry,
So I've been here about 4 months.
4 months.
Yeah.
And when did you transition from bakery to being
So,
a surgeon?
dear me. So it was before COVID. So we're probably talking 2018. I left bakery to start my health and social college course, sorry,
Mm.
and then did my nursing degree after that. So I only qualified this past Christmas.
I'd love to ask you what inspired you then to become a nurse.
I've always liked medicine. The idea of medicine has always quite entertained me. When you were younger, playing doctor and things like that, and it was really good. And then I sort of decided that bakery was more of a hobby, and then went from there and just thought, you know what, I think I just need to go for it.
Mm.
And best choice I ever made to come and work and be a nurse.
Wonderful. That's great. It's really inspiring to hear that you found this love and now you're doing this. How is your time? You've been here 4 months.
4 months.
Tell us a bit about your time here, from when you first started, how you felt, to how you're feeling now, what future looks like. Talk a little bit about
Okay.
that.
So when I first started, obviously you're nervous. You're
Yeah,
always
yeah.
going to be nervous, but sort of, especially Solihull side was so incredibly
Are you
welcoming.
quite local? Are you?
Yeah. So I only live in Hall Green.
Okay.
So it was obviously the obvious choice to work at.
Yeah.
QE is incredibly far away and far too big for the likes of me. So I joined Solihull, worked as a student on Ward 12 during my rotation.
Yeah.
So really took to it there. The manager there was so lovely. I said, look, I'm having a job here.
Yeah.
It was very forward and said, look, I want to work here. So we got all that in the workings. Very welcoming. Staff was so lovely. Really accommodating. Really sort of genuine people, really.
Yeah.
But it was really nice to sort of get involved and get stuck in really straight away with sort of the what do we call them? The not communities. I forgot what we call them.
Networks.
Networks. Yeah.
Yeah.
So really get involved with, especially the LGBT network. So I've now signed up to be the surgical representative for nurses, openly queer nurses,
Yeah.
which is really good. Looking to sort of get into the neurodiversity sort of area as well. So that'd be really nice to sort of connect with people and sort of bring more awareness, I suppose.
Yeah. So how did you find that? So when you first got involved with UHB Proud,
Mm.
what was that experience like? What do you think that brought in for you to do your role, and how did that help you?
So originally, I was only down in Leslie's office
Yeah.
to collect the pin.
Okay.
Funny enough, and she said, "We're actually looking for a surgical rep," and I said, "Oh, really?" And so we got talking, and it sounded something that was really interesting and really wanted to promote, especially with sort of in the news at the moment. There's a lot going on in the news
Yeah.
about representation and openly queer people really struggling in the workplace.
Yeah.
So I really wanted to make sure that we had a safe space here at Solihull and UHB as a whole
Yeah.
to sort of talk about that and make those issues more aware and people to be accepting of these things,
Yeah,
really. Yeah.
So for our listeners who don't know what a rep means,
Mm.
please explain what do you mean by being a rep? What responsibilities do you have?
So, as the representative, I cover Solihull specifically. I cover Ward 12, 14, and 16 as a figurehead, I suppose. If there's any sort of things that are brought up regarding LGBTQ rights, any sort of representation problems, anything like that, it will funnel through me, and then I will disseminate that to the rest of the team. Anybody that's having any trouble or any worries in those sort of areas can again email me or come to me to contact. It's sort of like somebody you can go and talk to, like a buddy almost that you can go and talk to, and we can iron out those sort of things.
Okay, no, that's really interesting. So you mentioned about how when you were on training, you went up to your manager and you said, "Hey, I'd love to work here," and you started ironing that out. What advice would you give to anybody who is here training, that wants to work here, wants to have a career here? What advice would you give to them, and how to go about that? You went very direct to your manager. Your manager was very helpful, I'm guessing. What advice would you give?
Confidence, I think, would be the big thing. You just if you found somewhere that you want to work, I think you just need to approach the matter. I mean, Ward 12 is student based. We have a lot of students that come through. A lot of them are interested, and I will go with them to the manager and say, look, you just have to let them know who you are. So just be confident, know that, if you found the right place you want to work, that that's what you want to do. Be committed to the idea and just be confident with it. Go in and say, look, I would love to work here. It's a great team. How do I start the process? Is it something that you're open to? Do we have the staff available? Just ask those questions and, have a good relationship with the manager on
That's
board.
great advice, just about being upfront and asking.
Yeah.
But that's great. What advice would you give to I'm sure a lot of managers listening to this podcast as well. What advice would you give to managers about how to deal with that kind of approach? What would you say? What more support can a manager give to students or to someone who was in your position 3-4 months ago?
Okay, so from a manager's perspective, again, being open to the idea, don't just immediately say, well, we've not got the room. Think ahead. I've had a couple of students that aren't finishing yet, but, we're going to have availability in sort of a year's time, year and a half time. So they'll write the names down, they'll write the contact numbers down. So from a manager's perspective, just be open to the idea, be willing to say, yeah, that's, I know you, nice to meet you, good talking to you, and I'll keep you in mind, and I'll let you know if there's a posting, because people will be searching for jobs online for as long as it takes, but you don't get to know the manager beforehand. If you found a spot as a student that you like to work in, build that rapport while you're still there, get to know them, talk to them, even ask them how the day is going. Good morning, manager, or whatever their name is, how are you doing? Is your day going okay? Build that sort of relationship.
I love it. I think that communication part, building that rapport, building that trust
so important.
is really, really important. You've really nailed it. So what does future look like you, Alex, at Solihull, at UHB?
A very good question. I mean, a lot of us get itchy feet on 12. It's something, it's part of the ward that, we're very, I wouldn't say we're not calm, we're very busy, but the work is sort of, we don't experience many poorly patients, so people tend to get itchy feet. It's a very common problem, and it's something that the managers are used to, and that's why they sort of look for jobs a year down the line. For me personally, theatre, I've always thought about moving to theatres, sort of experiencing the pre-surgical side of things. I'm looking at conferences. I went to a wonderful conference last week about sort of the procedures that we see on 12 and how they're done, so that gives you better insight, and I think theatres would be good. I'd love to stay with UHB as a whole. But at the moment, I'm quite happy where I am for the next couple of years. But if I was to move, it would be probably theatres or something.
I really like your take on your role, and I think for the listeners, some of the takeaways is that extra step that you go about going to that conference, and learning about your role, learning about the hospital, learning about thinking about that lateral move. Just because you get itchy feet doesn't necessarily mean you've got to go and leave the organisation. There's other areas, like you said, you've identified theatres. So for the listeners, I think it's important for them to understand that there is career opportunities laterally, and obviously you can progress as well. It's about knowing, and after knowing, it's
knowing
about
what you want.
It's about continuously learning, like going to those conferences, doing that extra bit, standing outside of the
attending your trainings.
So I really like that. Really like that. Just before we wrap up, then I just want to ask you, what does inclusion mean for you? I mean, you've been here 4 months. What does inclusion look like at Solihull, and what are you most proud of?
I mean, as being openly queer, somebody that's on the, with the neurodivergency and things like that, I think the most important thing about inclusion is understanding. I think, you're going to get people, not in this trust, but you're going to get people outside looking in that won't understand, that won't necessarily respect who you are as a person. But within UHB, there are so many people, and there are so many contacts and connections that make you feel that you are in the right place and that you feel included in work as a team. Regardless of who you are, regardless of your background, there are people, the inclusion team, the UHB Proud Network, there are people that you can go and speak to and that you feel included. And even on the ward, nobody's afraid to ask, well, how's your boyfriend doing? It's not something like, they're saying, well, how's your partner doing? How's your boyfriend? Are you going to go and see him? This sort of thing, it's not something that is a taboo topic for anybody anymore. And I think just being confident and being open enough to say, look, this is who I am, this is who I'm going to be, we can work together, and it's just about teamwork and feeling included. And at the end of the day, it's about the patients. If you don't necessarily get along, that's fine, but just feeling that inclusion, especially from Solihull, who's been incredible, especially newly qualified. It's
Yeah.
so nice to just have that, you know, family
I
basically.
love your take on that. It's about bringing yourself, whole self to work, and you truly can because you've got that support environment around you.
Exactly.
And for anyone who feels like feeling comfortable, they're scared, the support's there, the networks are there, the champions are there, and I think you've summed it up really nicely to end with saying that it's about the patient care.
Yeah.
If we feel like we can bring our true self to work, we can give the best patient care, and I think
Exactly.
the inclusion team, Solihull, everyone together is really
Yeah.
doing a good job of that, at least from what I've heard from you.
Yeah.
So
There's no need to be afraid.
thank you very much. Just to finish off with this, there's one thing that inclusion or Solihull can do to improve, to make life easier. What would that one thing be?
I think, I mean, even today I've just come from a network meeting, and there was a lot of discussion about sort of how it's communicated, how that information is disseminated among staff.
Yeah.
So I think if we can just work that little bit extra to sort of communicate just that bit more, I think that would be really important. Sort of understanding where everybody's got opinions. But just understanding that those opinions need to be collated and disseminated in a way that everybody understands, I think would be really important. I mean, we are spot on about communicating at UHB. It's, we've got the communication board, we've got the emails, everything like that, but just a little bit extra just to push for the LGBT plus, I think would be really important for us.
Thank you, Alex. It's been an absolute pleasure.
Thank you for having me. It's been amazing.
Really been inspiring. Thank you very much.
Thank you.